Today, medical science is advancing faster than ever. We can edit genes, cure wounds, fatal diseases, and perform surgeries with robots guided by artificial intelligence. Yet, millions of people are brutally left behind, not because medicine has failed them, but because unilateral coercive measures block their access to the most basic care. In some places, over 85% of commonly available medicines never arrive. Children with conditions like epidermolysis, bullosa died 15 in a single year simply because bandages could not be imported. In Iran, deaths among thalassemia patients rose from 25 to 35 per year to over 150 to 220 per year, and life expectancy plummeted from around 45 years to under 20. Beyond medicines, sanctions devastate entire health systems. Hospitals cannot purchase generators, fuel, replacement parts, or software. Ambulances cannot run for lack of gasoline. Medical students cannot access textbooks, laboratory materials, or training equipment. In several countries, up to half of medical professionals have left worn down by impossible conditions and collapsing salaries. In Zimbabwe, the vacancy rate for midwives stands at 89%. The economic crisis brought about by UCMs is also seriously affecting people's health. In Venezuela and Syria, over 90% of the population now lives in poverty. Children become severely malnourished. In Venezuela, only 1.5 meals a day is the new normal. In Zimbabwe, 60% of households are food insecure. Some patients, forced to choose between food and medicine, sell their own life, saving drugs to survive. This is precisely the suffering that the people of the sanctioned country are currently experiencing. Health is impossible without clean water, electricity, and sanitation. Yet in many sanctioned countries, water is available only a few hours per week or not at all. In Syria, hospitals receive electricity for 1 to 2 hours a day outside major cities. The consequences are immediate and deadly: cholera, dengue, typhoid, rising pollution, unsafe cooking methods, and contaminated water. A child cannot wash their hands. A mother cannot boil water. A hospital cannot power an oxygen machine. This is the daily reality. UCMs do not merely restrict governments, they suffocate civilians. They turn treatable diseases into death sentences. They turn functioning hospitals into silent buildings. They turn poverty into starvation and hope into despair. This is not a political issue, but a human issue, a moral issue. No child should die because a bandage is considered a duly used item. No mother should give birth in the dark because fuel cannot be imported. No patient should suffer without painkillers because a bank fears penalties. Let us remember, health is not a privilege granted at the discretion of powerful states. It is a universal human right.